You hear that, Ricky? The trick is to read when it's at the top.
Ja, ja. morning, everyone. My name is Taurai Muranda, and I'm the chairperson of the Board of Trustees of the Assupol Community Trust. I would like to extend a warm welcome to the Board of Trustees, the representatives of the designated communities of Msinga, Ngutu, and Nelmapias present with us, our partners and stakeholders, and everyone attending this AGM for the Assupol Community Trust. Please note that we are webcasting and recording this morning's proceedings so that we can prepare minutes for stakeholders, trustees, and all our partners that are unable to attend today. With us today, seated on my left, is Dr. Vuyelwa Hlapo, the CEO of the Assupol Community Trust. And on my right is Reiki. Hi, Reiki, who is the Senior Executive Manager in Group Finance. The agenda for the AGM has been circulated accordingly. At this point, I would like our Secretariat to establish if the meeting as duly called forms a quorum for the annual general meeting. I'm handing over to you, Tuso.
Thank you, Chair. The Board of Trustees fixed the 6th of October 2022 as the record date for determining stakeholders entitled to vote at this meeting. The proxy statement and the previous annual report were emailed to all stakeholders. The quorum of 50% of the mandated designated community representative is present. Therefore, a quorum is formed. Back to you, Chair.
Thank you, Tuso. On the basis of the Secretary's report, the meeting is duly convened. The polls for each matter voted on at this meeting will open when all the proposals have been presented and will close immediately prior to adjournment. Now we'll conduct the formal business as set forth in the notice of the AGM. In order to conduct it in an orderly meeting and give all eligible stakeholders an opportunity to participate, we will follow the procedures in the agenda. During the conduct of the formal business, questions and comments from the floor should pertain to the specific proposal then under consideration. I ask that anyone wishing to speak or raise a question, please raise your hand. On that note, I would like to hand over to Dr. V to give us her CEO's report. Thank you, Dr. V.
Thank you, Chair.
Sorry, where's your report?
Thank you, Chair. As introduced, my name is Vuyelwa Hlapo, and I'm the Chief Executive Officer for Assupol Community Trust. Let me start by greeting the Board of Trustees of Assupol Community Trust, led by the Chairperson, Assupol Holdings Executive and staff, the local ECD committees representing the designated communities we serve in Umsinga, Ngutu, and Nelmapias, our partners and key stakeholders, the Assupol Community Trust team, and everyone attending this annual general meeting today. It is proper to first say thank you to all our internal and external stakeholders, our partners, and the ECD sector, whom without them it would not be possible to achieve what we have achieved, despite the challenges that we faced, which were brought by COVID-19 pandemic. Siyabonga kakhulu ngokusebenzisana. Thank you very much, Chairperson, for allowing me an opportunity to present the annual report for the Trust. This report is for the period 1st of March up to the end of February 2022. The structure of the presentation is as follows. In my presentation, I will first outline the purpose of the presentation. Secondly, the vision, mission, and values of the Trust. Thirdly, our key strategic objectives and desired outcomes we want to achieve through the objectives. Then I will share our performance on the key strategic objectives. I will then conclude by indicating challenges we faced during the year under review. The purpose of this presentation is to provide an annual performance report to the AGM of Assupol Community Trust on the implementation of the operational plan for period March up to February 2022. Our vision and mission and values are as follows. Our vision is to make sure that every child is ready for the future. And our mission is to play a leading role in impacting the delivery of quality ECD in designated areas. We have our values, which include the following. We are loving, meaning that we care for our staff and all the children we serve, including differently abled children. We are innovative and responsive. We look for innovative solutions for our context. We need to be agile to achieve under different circumstances. We have respect and dignity. We treat all stakeholders, children, mothers, fellow trustees, and staff equally with respect and dignity. We show respect and dignity that drive us to do the right thing. We want to leave a legacy. We have a passion for what we do. We strive for quality in all we do. We serve a nation inclusive of all stakeholders. We collaborate. We engage with communities and other stakeholders towards sustainability. We look for opportunities to empower all those we work with in our ecosystem. Integrity and accountability. We are ethical in all we do. We are transparent in everything we do. Ibhodi labaphathiswa libeke lezi zinhloso zamasu ezilandelayo ezinhlanu. These are our 5 strategic objectives. First, to improve access to ECD for children between 0 to 5 years in Nelmapias, Umsinga, and Ngutu by 2022. Okokuqala ukuze sithuthukise izinhlelo nezinsiza ze-ECD ezinganeni ezineminyaka ephakathi kwengu-0 ukuya kwemihlanu ubudala eNelmapias, eMsinga naseNquthu ngo-2022. Secondly, to improve the quality of ECD services in Nelmapias, Umsinga, and Ngutu by 2022. Okwesibili, ukuthuthukisa equality yensizakalo ze-ECD eNelmapias, eMsinga naseNquthu ngo-2022. Thirdly, to facilitate compliance in accordance with basic standards of registration, health and safety in line with the Children's Act number 38 of 2005 and municipal bylaws in ECD facilities in Nelmapias, Umsinga, and Ngutu by 2022. Okwesithathu ukugqugquzela ukuthobela umthetho ngezimiso eziyisisekelo zokubhalisa ezempilo nokuphepha ngokuvumelana nomthetho wezingane nezimiso zikamasipala ezikhungweni ze-ECD eNelmapias, eMsinga naseNquthu ngo-2022. Fourthly, to promote good governance, partnerships and stakeholder relations in the city of Tshwane and Umzinyathi District Municipality. Okwesine, ukukhuthaza ukuphatha okufanele ubambiswano nobuhlobo nababambi maqhaza eCity of Tshwane naseMzinyathi District Municipality. Lastly, to advocate for models that accelerate universal access to ECD. Okugcina, ukukhulumela iziboniselo ezisheshisa ukutholakala kwe-ECD kubo bonke. What are the outcomes that we want to achieve as the trust? These are the following. We want to increase the number of children accessing ECD in Nelmapias, Umsinga, and Ngutu. Sifuna ukwandisa isibalo sezingane ezithola i-ECD eNelmapias, eMsinga naseNgutu. We also want to increase the number of children living in an environment of care, development, safety, and security. Sifuna ukwandisa isibalo sezingane eziphila endaweni yokunakekelwa yentuthuko ephephile nevikelekile. Thirdly, we want to see children performing better and being ready for school. And this is in terms of health, growth, and nutrition. Sifuna ukubona izingane ezenza kangcono futhi ezilungele ukuya esikoleni lapho sibheke impilo, ukukhula nokondleka. We want to see parents involved and supporting the development of their children in Nelmapias, Umsinga, and Ngutu. Sifuna abazali abaneqhaza nabasekela ukukhula kwezingane zabo. And lastly, we want the City of Tshwane and Umzinyathi District Municipality, including Umsinga Local Municipality and Ngutu Local Municipality, to prioritize ECD through funded programs in their integrated development plans. Okugcina, sifuna iCity of Tshwane, Umzinyathi District Municipality, kuquka umasipala waseMsinga nowaseNgutu, babeke phambili i-ECD ngezinhlelo ezixhaswa ngemali ezinhlelweni zabo zezentuthuko ezihlanganisiwe. The impact of COVID-19 in our work. The past year has seen a glimpse of normality return to a sector that had been devastated by COVID-19 and our national lockdowns. Kancane kancane izingane ziye zabuyela ezikhungweni ze-ECD. Inqubekela phambili enkulu uma kuqhathaniswa no-2020. Sikwazile futhi ukuhamba nokuphinda senze imisebenzi yethu futhi siye senza inqubekela phambili emangalisayo yokufinyelela imigomo yethu. Kodwa imithelela ye-COVID-19 iselokhu ikhona phakathi kwethu. Ngenxa yalokho yize sijabula ngomthelela womsebenzi wethu nalokho esikufinyelele ngokwemigomo esizibekele yona, asibushayi indiva ubukhulu benselele esibhekene nayo. Imiphakathi ehlwempu esisebenza kuyo isabhekene nobunzima bokuwohloka komnotho, ukwenyuka kwentengo yokudla nophethiloli kanye nokuswelakala kwemisebenzi okuqhubekayo. The COVID-19 relief plan that we had in the 2021-22 financial year, the Trust received its COVID-19 relief plan, which in the previous year included the payment of stipends to ECD practitioners to address the loss of income and the provision of personal protective equipment to enable the ECD sector to comply with the guidelines of the Department of Health and the Department of Social Development. In 2022, the Trust focused only on the payment of operational costs with a view to assist unfunded ECD centers in their operations, including payment of rates and taxes. Of the 102 ECD centers targeted during the year under review, 99 were unfunded ECD centers that were supported with operational costs for a period of 6 months. The 3 remaining ECD centers qualified for funding from the Department of Social Development. This performance can therefore be viewed as 100% performance. With regard to progress on strategic objectives, enkqubekela phambili emigonweni yamasu, we have made progress against our objectives in the year under review, and since our first audit and strategic cycle in 2016. However, we do recognize that the issue of access to ECD is the elephant in the room that cannot be fully addressed in 3 years. Sometimes, in fact, the scale of the challenges faced by the sector can seem overwhelming. At such times, looking back at our steady incremental progress reminds us that change is indeed possible, and that if we remain committed, the scale of that change might surprise us. In order to gauge that progress, I'm very pleased to report that we instituted a formal monitoring and evaluation program in the year under review, which went live on 1 March 2021. This system will allow us to better track our progress. Our progress against each of our 5 objectives is therefore discussed below. With regard to access to ECD services in Nelmapias, Umsinga, and Ngutu, lo mgomo wamacebo uhlanganisa umgomo oyisisekelo we-trust ukufinyelela ukutholakala kwama-ECD emhlabeni wonke ngokuvumelana nohlelo lwezentuthuko kazwelonke luka-2030 lwaseNingizimu Afrika. Nakuba ukufinyelela i-ECD ngokulinganayo kuwumgomo oncomekayo, izingane zemiphakathi yasemaphandleni nehluphekayo zibhekene nezinye izinselelo kulolu daba. Futhi umsebenzi wethu wokuthuthukisa ukutholakala kwale mfundo udinga isu elibanzi futhi elihlanganisa bonke abantu. Eminyakeni engaphambili, itrust yenza imikhankaso yokuqwashisa umphakathi ukuze iveze ukubaluleka nezinzuzo ze-ECD ngenhloso yokunikelela ekutholakaleni kwe-ECD kubo bonke. Kodwa ke ngenxa yokuqubuka kwe-COVID-19 kule minyaka emibili edlule, lo msebenzi awukenziwa okube nomthelela ongemuhle neze kulo mgomo. Ukwanda kokutholakala kwe-ECD okwafinyelelwa kuyancomeka uma kubhekwa izimo itrust nalomkhakha ezizithole kuzo. A total of 2,655 new children accessed ECD services in Nelmapias, Umsinga, and Ngutu during the 2022 financial year. This number constitutes a 67% rise from the previous financial year. During the year under review, the Trust has seen great progress in improving access to ECD programs for children with disabilities. This is the first year to report on this. Izingane ezingamashumi amahlanu nesishiyagalombili ezinokukhubazeka zifunda kuma-ECD. Iningi lalezi ngane livela eGauteng. Lena intuthuko enkulu uma kucatshangelwa ukuthi izingane ezimbalwa kakhulu ezinokukhubazeka ezingena kuma-ECD. There's a need to do more awareness on the importance of ECD to improve access for children with disabilities. On the second strategic objective, which is to provide quality ECD services to children in Nelmapias, Ngutu, and Msinga. On this strategic objective, we focused on 2 areas, namely nutrition and training of practitioners. On training of practitioners, we know that the provision of quality ECD depends on practitioners having access to applicable skills. In the year under review, we had set a target of 232 practitioners trained, and we exceeded this target and trained 282. This included a cohort of 34 practitioners who received their qualifications after completing their 18-month NQF Level 4 training. We are beginning to see the positive effect of qualified practitioners in the work they do in the centers. On nutrition, We are acutely aware of the foundational importance of nutrition. No hungry child can learn and grow. In the year under review, 1,640 children were regularly fed with nutritious porridge, a slightly higher figure than in the previous year. This porridge provides 75% of the total daily nutrients intake required by each child, which means that even children from very poor households will receive the majority of the nutrients they require. We also supported 112 centers with food gardens in the year under review in KwaZulu-Natal, including for the first time centers in Nelmapias. These gardens produce nutritious vegetables that can supplement feeding programs and in some instances can generate additional income for the centers. On the next strategic objective on compliance with registration, health and safety requirements, this strategic objective also comprises 2 areas of focus. The first focus area is the screening of staff for security clearances in line with the Children's Act of 2005. Staff should be evaluated to ensure they do not have criminal records or a history that would preclude them from working with children. Abasebenzi kufanele bahlaziywe ukuze kuqinisekwe ukuthi abanawo umlando wobugebengu noma umlando ongabenza bangakwazi ukusebenza nezingane. This was an area in which we were not able to meet our target of 325 staff members and only managed to screen 203. This was unavoidable given that the process requires physically obtaining fingerprints, which was prevented under the lockdowns, which were only lifted late in the year under review. On the next strategic objective, good governance, partnership, and stakeholder relations. On good governance, we planned to have 4 steering committee meetings in KwaZulu-Natal and Gauteng. We, however, had 2 steering committee meetings in KwaZulu-Natal only. We also planned to support local ECD committees in the 3 designated areas we support. Out of the target of 14 programs for local ECD committees, we exceeded the target and supported 18 ECD committee programs. On partnerships established, we had planned to establish 6 partnerships. However, 3 partnerships were established during the year under review. We continued to maintain 4 existing partnerships that we had formed during the previous financial year. The relationships with our governmental and non-governmental partners in KwaZulu-Natal continue to be constructive and mutually beneficial, and we are very grateful for this relationship. Ubuhlobo nozakwethu abakuhulumeni nabangekho kuhulumeni KwaZulu-Natal buyaqhubeka bakha futhi buhlomulisa izinhlangothi zombili. The trust still strive to improve relations with the city of Tshwane and continue to believe in the benefit that may be realized from more frequent and substantive engagements. On stakeholder relations, another important part of stakeholder relations in our work is providing support to ECD forums. During the year under review, we supported 22 ECD forums out of a target of the 22 ECD forums. This was 100% achievement, a target. And this is an indication again of strong stakeholder relations that the trust has built over years. On the last strategic objective, which is to advocate for models that accelerate universal access to ECD, advocacy activities have been another area unavoidably impacted by COVID-19. In-person awareness campaigns educating parents around the importance and benefits of ECD were curtailed. but we did see non-center-based ECD practitioners play an important role in communicating the benefits of ECD programs, and hence saw an increase in children enrolled with day mothers and play group facilitators. We targeted 4 organizations adopting the trust delivery model, and were successful in presenting the model to 4 organizations. What were the challenges that we experienced during the year under review? There is still a challenge in getting used to the new way of conducting business during and post-COVID-19 pandemic. The effects of COVID-19 will still have a long-lasting negative impact on sustainability of ECD. The implementation of the strategic objective on facilitating compliance in Nelmapias continues to be a challenge, exacerbated by lack of commitment and weak relations with the city of Tshwane, and complicated by the laws on registration of ECD in the urban areas. I'm sure all those who operate in the urban areas do know about this. In closing, as I wrap up, let me reassure you that the Trust is committed to advancing our efforts to accelerate universal access and achieve the highest standards for early childhood development. In order to broaden the Trust perspectives, we look forward to continue this adventure with you. And I thank you.
Thank you, Dr. V, for such a comprehensive report. And well done, and congratulations to your team for all the sterling efforts you put on. Thank you. On this note, I'll hand over to Reiki to take us through the annual financial statements. Thank you, Reiki.
Thank you. Good morning. I have the pleasure to present you an overview of an annual financial statement of the Community Trust for the year that ended February 2022. The content of my presentation will cover the following: the purpose, overview, income statement, the resources of income, project expenses, and the balance sheet. The purpose of this presentation is to present the financial statements to the annual general meeting of the Community Trust for the Trust financial year stretching from March 2021 to February 2022. The Board of Directors approved the audited financial statements on the 20th of July 2022. It was prepared using the Trust's specific accounting policies that are consistent with the previous financial year. The financial statements are also prepared on a going concern basis. It is important to note that the financial statements were audited, and PricewaterhouseCoopers, the Trust external auditors, issued an unqualified audit opinion. As the CEO mentioned, the COVID pandemic still had an impact on the Trust activities, especially with the lockdown restrictions during the third wave that was around June, July in 2021. However, the Trust was able to do more on projects during this financial year compared to the previous financial year. In addition, to note that there were no material events that took place after year-end that had an impact on the financial statements. On the income statement, you will note that the Trust reported a loss of 15.4 million for the financial year ended February 2022, against a surplus of 2.5 million in the previous financial year. With the lockdown restrictions being slightly less than the previous year, the Trust was able to increase its spend on projects, but the aftermath of the pandemic was noted on the income resources. You will note that by looking at the the resources of income, that the performance on all the line items were lower in comparison to the previous financial year. On project spend, the expenses to the value of 26.2 million were incurred during the financial year, against the 14.1 million in the previous financial year. As previously mentioned, the lockdown restrictions being less severe than at the start of the pandemic, the Trust was able to increase its activities in the various projects in Mzingoti and Nelmapias. Included in operating expenses are funds that were specifically allocated to support the ECD centres with operating costs during the pandemic. And then looking at the balance sheet provides a healthy picture of the financial position of the trust with a total assets to an amount of 323.9 million that far exceeds the liabilities of the trust. To preserve the healthy state of the trust maintains an evergreen investment approach. This approach ensures that the sustainability of the trust and avoids the depletion of funds. This concludes the summary of the annual financial statements. Thank you.
Thank you, Reiki. I would like to open the floor for the duly elected stakeholders to vote for the adoption of the following resolutions. Resolution number 1, noting of the annual financial statement. I hand over to you, Tuso, to just do the polling and give us feedback. Thank you.
Thank you, Chair. We're just waiting for our third and very last vote.
Thank you.
We have received all the votes.
Okay, thank you so much. On that note, we can take it that it has been resolved that the presentation regarding the activities of the trust and the financial statements of the trust for the year ended 28 February 2022 are hereby noted. And on that note, we are moving on to our second resolution. The resolution would like to confirm the appointment or reappointment of the following trustees. Mr. Rai Muranda, who is myself, Dr. Natalie Skippers, Ms. Mui Mbambo, Ms. Teboho Malachi, and last but not least, Ms. Bridget Mukwena Halala. Tuso, please may you put it to our stakeholders for the vote. We are waiting for polling results to come back. Just be patient with us. Our secretariat is working on it.
Thank you, Chair. We have received all the votes.
Sure. Thank you. Thank you, Tuso. On that note, we look at it and say the resolution to reappoint the trustees has been noted. Thank you. Okay. I think we have actually finished all the matters which we're noting for noting on the agenda, Dr. V. And on this note, I would like to say once again, thank you so much to everyone for joining us at this AGM. It's always a pleasure to connect with you, even though we are doing it remotely and via YouTube and Teams. And to all our stakeholders, once again, thank you so much for the support which you give the Assupol Community Trust. We really appreciate it. To Dr. V and her team, ma'am, thank you so much for the sterling work that you do for the benefit of the communities. We really appreciate that. Reiki, we can never thank you enough, Vikas and yourself, for all the support which you give us on the financial side. And to my fellow trustees, thank you so much for supporting us on the board. It makes my work and Dr. V's work much easier with your support and guidance. And on that note, the meeting is closed. Thank you so much, everyone. Have a good day.